Well, people are cautiously easing back into their normal routines, and that includes their physical activity. Weekend pickup games of basketball are not hard to find. It is also likely, though, that these afternoon athletes are a little rusty, putting themselves at risk of injuries. Thankfully, there's a team to help ease your post-game aches and pains. And so good to talk again with Dr. Rodney Comisar with OrthoNeuro. How you doing today, doctor?
I'm doing terrific. Thanks for having me.
You know, we recently found out the NBA is looking to restart its new season, right, in December. That inspires people, right? People say, hey, I haven't played basketball. I want to get out and do maybe a pickup game or something. But there is a lot of danger, I guess, in the sport. So I want you to tell us, as a board-certified orthopedic surgeon, what are some of the risks? What are some of the more common injuries that you see?
Basketball is considered a contact sport as opposed to a collision sport like football or hockey. So we certainly see our share of contusions and joint sprains. It also is very susceptible to overuse problems just because of the jumping, the stop-start nature of it, and all the running associated with it. Certainly with respect to specific joints, we see a lot of ankle sprains. People tend to play on their toes to be able to move laterally, but also land from a jump on their toes, and that puts the ankle joint more in a vulnerable position, leading to rolled ankles or sprained ankles. We also see lower extremity stress fractures just because of the volume of running within the foot and the lower leg. The hand and wrist are susceptible. Reaching for balls, tipping a ball or deflecting it sometimes can lead to a dislocated finger, landing on an outstretched hand, spraining a wrist. The shoulder is also vulnerable with respect to blocking shots, grabbing rebounds, or just trying to reach and stop your opponent. And lastly, the knee is something that I deal with on a regular basis. And there's a myriad of knee injuries that can come from basketball.
And yeah, let's talk about some of those knee injuries, some of the most common things. And I think especially as we kind of get back into some physical activity in a lot of ways, right? People may have been a little more stagnant the last 8 months. What are some of the risks there?
Well, absolutely. People are very vulnerable to overuse problems, either just coming off the sidelines, so to speak, if they've been sitting around during COVID, unable to participate, but also coming from a fall sport like soccer or football. Use different skill sets, if you will. There's different sport-specific movements. Trying to get into football shape is different than getting in basketball shape. So we see a lot of overuse problems. Jumper's knee or patellar tendonitis is very commonplace early on. But then we also see traumatic injuries like meniscal cartilage injuries from a twist, the dreaded ACL tear, which can be an epidemic in some cases with especially female athletes, and also patellar instability or dislocations, which can be kind of a great mimicker of an ACL.
All right, let's talk prevention, ways that people can stop these from happening.
Well, I think in some ways COVID's helped us in diminishing the amount of athletes that have been playing year-round. We know that doesn't seem to bode well for injury risk, so people have been limited access to gyms or competition. Certainly as you transition from one sport to another or coming off the sidelines, so to speak, you kind of have to get in basketball shape. So there's a lot of running and conditioning that has to happen with that hydration, stretching, and it's important to maintain a strength training program. Lastly, for women in particular, there are ACL prevention programs that have been started, initially tested in Europe in soccer athletes, and it seems to have an effect on lowering the risk of ACL injuries, kind of teaching women how to land, how to cut, how to jump, things like that.
Okay, and so if somebody does have one of these injuries, let's talk about maybe the knee, if they hurt it in this way, what are some of the options for treatment?
Well, early on, typically there's a trainer or coach on site that can assess them. If you can't weight bear or walk without a limp, we typically recommend crutches, icing, and we have orthopedic urgent cares in our practice at OrthoNeuro, as well as surgeons like myself who are within 24 hours, we can get you in and evaluate you. The majority of the time, these things don't need surgical intervention, but sometimes that can be done arthroscopically to trim cartilage or reconstruct ligaments and hopefully get you back in the game.
Yeah, definitely. And I do want to reiterate as well, offices such as OrthoNeuro, completely safe to visit now. You can go to the website, orthoneuro.com. You can even make appointments online if you want to start there and head in if you have any questions, any concerns, right, before picking up a sport again. So Dr. Comisar, thank you so much for being with us.
Thank you, Robyn.